Dr. Rebecca Starr is the medical director for the Pioneer Valley Memory Care Initiative. And that program is phenomenal. I've been able to be a part of it since we got involved, as Amherst Neighbors has got half a dozen folks that we work with our volunteers. Again, friendly visits, games, walking, spending time with folks that have some cognitive challenges and help them to figure out ways to stay in their own home and also give a break, give a break to the caregiver or family member, spouse, or significant other who's, carrying a lot of the weight to help make that work for them. So it's a great program. She also oversees geriatric focused projects as part of the Mass General Brigham Cooley Dick Hospital. I'm going to let Dr. Starr share her recent transition to a different type of practice than what she'd been doing, but she's very much considered an expert in memory and memory-related challenge in our region and beyond. And we're super excited to have you share your thoughts and hopefully some good Q&A down after you speak. Dr. Starr.
All right. Well, thank you so much for that lovely introduction. I'm really excited to be here. I can see by the number of people that this is a topic that I think a lot of people think about and often worry about. It's certainly been something that touches my work life on a regular basis, and certainly my home life with family members. I have learned so much from the patients and the family care partners, and I'm very grateful for all of that. I'm very grateful to be able to have this program, the Pioneer Valley Memory Care Initiative. It's a grant-funded program sponsored in large part by the Eisenberg Family Trust. And we work closely with the neighbors. We're in East Hampton, Northampton, and Amherst, of course. And I think to your point, Larry, to keep people home for as long as they want, and I think that's generally what most people want. And we support the people who have cognitive impairment as well as their care partners, giving them support. And Karen Romanowski has set this talk up, and I want to thank her for all her amazing work, and Sharon Asher and everybody part of the program. So I want to take the time to talk about this, and there is so much ground that could be covered. I always have to narrow down the slides to something that we can actually focus on. I have plenty of other information in the wings, if you will. But I always want to make sure that I'm focusing on what people want to hear. And so I would love to take just a few minutes and have anybody speak up to say, what are things that you'd like to hear about today, or what are you hoping to come away from this talk with?
Well, I'll get the ball rolling just so other people can jump in too. For me, it's like, okay, when I know somebody really well and I can't come up with their name for the life of me, or when I walk into a room because I started to do something, related to an errand or some project or something, and then I'm in the room and I haven't a clue why I walked in the room, I'd love to, get some sense of boundaries around what sort of normal forgetfulness that just happens in life versus early signs, the earliest of signs that might be something more meaningful going on. So that's me. Others can jump in.
Thank you.
That's exactly what I am interested. It's exactly stated perfectly what I want. It took me 10 minutes to think of a word that I wanted today, and I just couldn't. And then it comes a half an hour later. So I don't know. I don't want dementia, but I don't know the difference between what's normal and what's not.
Right. Thank you. That's very well stated. A big something we hear often. Let's see, Mary.
I've got a question about how you figure out if dementia that your mother had might transfer to you, or be in your genes, even if you don't have the high blood pressure that your mother had. And that's what I'm interested in. What likelihood would there be that I would have it as well?
Great point. Great question. Anything else?
Yes, this is Scott Nielsen. And, Mike, I echo the other questions. A bunch of our friends talk about the carousel. As someone was saying, it couldn't remember a word for 10 minutes, right? But then it comes around, the carousel finally comes around. So I kind of see that as normal decline. The question is, what indicates that there's some kind of dysfunction? If I can't remember something that happened 5 minutes ago, et cetera. And what are things that we're just out of practice with, kind of deconditioned to our work lives. And so, we aren't forced to be as sharp. But so that the memory issue of what's the difference between normal decline and what might be a sign of dysfunction obviously is a concern. But sleep is a greater concern for me than anything else. And, reading that, sleep problems with serious sleep problems like apnea, et cetera, there's a higher probability, of developing Alzheimer's or, other forms of dementia. So sleep is a critical issue as well for me to understand.
All right.
Good.
Thank you.
And I'd like to ask a question. My wife over the last 6-7 months has shown a decline in ability for short-term memory and long-term, not so much long-term, but particularly short-term, where, forgetting what day it is, forgetting what appointments are, and then repeats things very often that she's just asked about. And I'm wondering, what is the best way to deal with that?
Mm.
How do I cope?
Respectfully.
Because we dearly love each other, but it's sometimes difficult to manage that.
Mm-hmm.
Dr. Starr, we have a question from Alan Hurwitz too. Alan, if you want to go ahead and.
That's
Hi, thank you. Can you hear me?
Julia.
Yes.
hear
Alan,
me
yes,
okay?
I can hear you.
Yeah,
Yes,
we can
you're
hear you.
welcome.
Yeah, I'm a lot of us, myself included, are interested in, what's normal and what isn't normal. And I am also, but I'm very interested in knowing what kinds of treatments are available for things that aren't normal. Because there's a part of me that doesn't want to know about anything that can't be fixed. I'd just as soon not know about it. Some days I feel. So, what can be done? And I'm interested in both in that question for sort of not that serious things. How can we get our mind sharper? And also for serious things. Because
All
I
right.
think there are, but we don't know them.
Sounds good. In some ways, that's why I try to avoid seeing doctors, right? Dr. Romney, did you have a question or your hand was up?
Yes, I know that the World Health Organization has mandated cognitive rehabilitation to help solve the problems of dementia. And I'd love to know what you think about that and what kinds of cognitive rehabilitation you're recommending or familiar with.
All right. Great. All right. Well, I think that's a good start. We will get started.
Dr. Starr, if I may, Michael does have a question. His hand is up. Just 1 second.
Okay, yeah.
Michael, you're muted. If you can unmute yourself.
Yeah, Michael Childs. Thank you. My question really has to do with, are there any self-administered tests that people can do in their homes, which can say basically, oh, you need to go see somebody about this? Or whether it's, right now, my wife and I, we play Wordle, we play connections, we play spelling, and we do all these things, and we support each other in saying, wow, our memory is pretty good today. But I'd like to know if there are more serious self-administered tests that can be administered that can tell how your memory is doing.
All right.
Thank you.
Anybody else?
Linda Gripko. Linda, if you have a question, if you can unmute yourself.
Yes, mine actually goes along with what Michael just said. I don't know what testing is available now for people whose parents have been diagnosed with Alzheimer's. I think that the testing is changing, and I'd like to know if there is testing available.
Okay. All right, I'm going to go ahead and share my screen. All right, can everybody see?
Yeah.
All right. When I've got the screen up, it really limits everybody that I can see. So let me know if anybody's got their hands up. We'll stop at different parts to see if anybody has questions. Okay. So again, thank you, Amherst Neighbors, for having me here. I'm going to see if I might not be able to move it. So I might have to stop the share for a minute. Bear with me. Okay, I'm going to try it again. We had it going, but okay. Everybody can see and hear the slides. Great.
Yeah.
So our objective is to review how our memory works, describe the normal brain changes as we get older, describe the type and range of these, discuss cognitive impairment and dementia, review evaluation and treatment, and then talk a little bit about the importance of future planning and caregiver supports. And again, thank you to PVMCI for funded by the Eisenberg Family Trust. So the brain, what is it, right? It's an interesting organ in that I think we take for granted so much of what it does, right? We tend to think of our heart as this, an organ. We see the cardiologist. We're very well versed in the different parts of the heart that we have to worry about. But the brain is really complex. And I think because of that, we don't focus on it enough. And there's so many things that the brain does that we take for granted, like breathing, like temperature control, like the ability to maintain our blood pressure, our heart rate. Every process that regulates our body happens in the brain, right? And together the brain and the spinal cord that extends from it makes up our central nervous system, or abbreviated by CNS. So I wanted to talk a little bit about what the brain is and what it does, right? Because it doesn't all do the same thing. Forgive me if many of you know this already. But the frontal lobe is involved in personality, decision-making, and movement. And it's actually one of the last parts of our brain to develop, which is why we don't want kids driving until they're a certain age. We don't want them voting, and we don't want them drinking. And, as my son, who is 13, leaves the house with no shoes on and doesn't realize, you can see why this part of the brain is so important in our day-to-day lives, making good decisions, for example. The parietal lobe is the middle part of the brain, that's the yellow, and it helps a person identify objects. It interprets pain and touch. It's the language area. It's where our one of the middle cerebral artery flows through. It's our ability to move our bodies. And so it does quite a lot. The occipital lobe certainly does a lot as well, and it's really involved with vision and interpretation of what we're seeing. Remember, the eyes are, they see things, but it's the occipital lobe that determines what it is we're seeing. And then the temporal lobes, those are the green lobes. That's where there's short-term memory, musical rhythm, some smell recognition. The cerebellum is in gray. That's involved in balance, proprioception, where our body is. And then you can see the spinal cord. And let's see if I can. All right. So memories, where are they stored in the brain? So in the hippocampus, and if you remember, that was the green, the temporal lobe. And that's where you're going to store these autobiographical memories from specific events, having coffee with a friend, for example. The neocortex, that's where info from the hippocampus is transferred as general knowledge. So coffee provides me with a pick-me-up, right? The amygdala, and you can see that right here. This is attaches emotional significance to memories. And so strong emotional memories are difficult to forget. And often, what often has been buried for decades might come out as somebody gets older for a variety of reasons. So all those memories that you put away from childhood might become stronger. The short-term memory relies most heavily on that prefrontal cortex, and the long-term memory is stored in various places in the brain. And it's important to note that the short-term memory has to sort of get taken in, and then it moves to different parts of the brain. And so it might be harder to remember things that you learned just recently versus those long-term memories, which are really entrenched deep in the brain. So again, with dementia, the short-term memory is often affected first. And so that's why people might be repeating themselves. And then the long-term memory is often present until late in the disease of dementia. So normal aging, what's great about it? I think it's really important that we talk about the strengths of getting older, right? You can really see the entire forest better than the trees. And as we get older, we have strengths and weaknesses. So as we get older, like our skin or our spine or our height, our brain shrinks in volume, particularly in the frontal cortex, and much of it is considered normal aging. Sometimes we see more. As we get older too, our blood pressure might rise. We, get diagnosed with hypertension. Our vasculature gets stiffer. The possibility of a stroke and ischemia, and that means not having enough oxygen to the brain for a variety of reasons, can increase. And then memory decline can occur with aging as well. And brain activation becomes more bilateral for memory tasks. So it needs to be stored and the brain needs to work together, both lobes. So some changes in thinking are really common as people get older. And we talk about normal versus not normal. I would say it's common. It doesn't happen to everybody, but it might be slower to everybody's point to find words and recall names, but you can remember later in the day. And so it's the tip of the tongue, right? Oh my gosh, I know that word, or I know their name. It's right there. And then when you're thinking or you're laying in bed, you're like, that's it. That's it. It sort of comes to you. This is really common. I hear about this all the time. I am terrible with names. I've never been good. And, I joke about having that tattooed. Has always been bad with names, right? Some of us are amazing. They can walk into a room and they can hear everybody's name and they know it. So it's also a skill set. So I think it's important to think about, have I always not been so good with names and now it's getting worse, versus I was always really amazing with names and now I'm really struggling. People find that they have more problems with multitasking. And I think we're seeing more data on this, that maybe nobody can really multitask, right? We might think we do it well, but really we're not, or it causes problems in the brain that we don't consider. Everybody's on their phones and listening. And I think we know as we get older, it is harder to multitask. And so sometimes people will say, well, I was driving with them. They were driving and I was talking, and then they couldn't remember a word I was talking about. And I said, well, I think if you're going to ask me, the focus should be on the driving and less on the talking and listening. And so part of it is saying, all right, they're driving. I'm not going to really say anything or talk about anything that I want them to remember, because I want them to focus on their driving. There might be mild decreases in the ability to pay attention. I want to focus on that for a minute or two. Right, nowadays we hear about kids having attention deficit disorder, right? ADHD or ADD. And I think we're much more aware of it and we're diagnosing it. But I think that's really, maybe more over the last 20 years, 20, 30 years. But, back when many people were in school, it was not diagnosed. And so you managed to get through school one way or another, or didn't get through school, and did more of perhaps, worked in a factory, or you just developed some abilities to get you through things, right? But now it's getting a little harder. We don't have a lot of research on attention deficits in older adults. The data is all shown to say that it's neurodevelopmental. So the behavioral neurologists do not feel that we can develop ADHD as we get older, that we had it and it's getting worse. But I honestly don't know. I don't know if that's the case, but we do know that there is a change in that. We might misplace things like glasses. We might forget what we're going for in a room, and that's really common. My grandma used to joke and say, well, she would be going up the stairs and stop to remember, she couldn't remember what she was going upstairs for, but she did always know she was going up the stairs. It had never got into the place where she couldn't remember if she stopped on the stairs, if she was going up or down. So, but that really is very common, and it might take longer to learn new information. So whereas when you were younger, you were able to grasp an idea right away. Now you might have to hear it a few times or come up with some more tricks to learn it, or you could always learn things no matter what time of the day. Now you're finding that you're more tired in the evening and it's harder to remember. So those are all things that we consider common or normal. I want to stop there and just think about that for a minute. And so I'm hoping that, what people brought up that we touched on is a lot of people's questions. So again, in a few slides, we'll be able to stop and ask some questions. But we know evidence has shown that there are proven ways to improve and help maintain memory. And number one, learning a new skill. Our brain is pretty amazing. Neuroplasticity is there, and that means that the brain can learn and grow no matter what age we are. And we should take advantage of this neuroplasticity. And learning the new skill sort of creates new pathways. It's like if you had vascular disease in your legs and you walk more, you're going to get these collaterals. And so you're going to build these collateral pathways. And the goal is not to be good at something, right? The goal is to learn that skill. So you might not ever be good at trumpet playing, but the fact that you're trying is going to be great for your brain, or learning a new language. It might be frustrating, and that can have its own side. So I don't want you to get frustrated, but that's there. Following a daily routine, that can be really important. You put your keys in the same place every day. You have a bowl on your counter and your keys go in there, right? When you get out of the car, you tell yourself, all right, these are the 3 things I have to check. Or when you get in your car, I have my phone, my wallet, my purse, I'm good to go. And so it's making these to-do lists, right? Or using these memory tools such as calendars and notes. It is important, though, that you don't have notes all over the place. That can make things much harder and be stressful. And so come up with one system that works for you. Some people put things on their phones. Some people like to write them down. The great thing about writing them down as opposed to typing is that the writing itself happens in another part of the brain, and that actually can help reinforce what you're doing. So again, putting your everything in the same place, glasses in the same place. And I'm not gonna lie, there's times I've looked for my glasses and they're on top of my head. So that's probably not the place to put them, right? Stay involved in activities that can help both the mind and body. I think this is so important. Sometimes, we're so active in our lives when we're younger and then we retire, but we don't have a great plan. And I think not having a plan gets people in trouble. I think it's really important that you do have a plan, that you don't start Tuesday and say, oh gosh, what am I going to do on Tuesday? You really want to plan for your week or your month. And if you don't have activities, it's important to think about what are the things I want to do or enjoy, and how can I build them in. Volunteering. And this is where Amherst Neighbors is amazing. All the volunteers are fabulous. You can volunteer in your community. A shameless plug, we're always looking for volunteers for PBMCI. You can volunteer at a school, a library, your place of worship, at food kitchens, Cancer Connection in Northampton. There's a lot of places that you can do this. And we know that this keeps, again, your mind and body well. There was this really great study done, and I can't remember what city it was done, but where it had grandparents come and volunteer at the public schools, for the elementary schools. And those that volunteered were much more active, and their health was better, their blood pressure was better, their mind was better than those that were not active and doing this. And so they really showed in a very beautiful way that doing these things, what we consider simple things, makes a huge difference. And spending time with friends and family. And we saw what COVID did, how the social isolation in the beginning especially was very important. We didn't know what the disease was like, what the virus was like. We didn't have vaccines, but we also saw how staying so isolated actually affected people in a way that's not good. And I appreciate both sides of things. You want to make sure that you stay healthy, but you also want to make sure that you're active physically and mentally. Sleep. And so sleep was mentioned. Sleep is huge, right? We know that studies are showing that sleep, good sleep can sort of get the amyloid, these plaques, out of our brain. And so if you're not sleeping well, you really want to bring this up with your PCP. Don't self-medicate. I think that's really important. Those medications, I just saw somebody today and wasn't listed on their meds, but they're like, I'm like, do you take anything over the counter? And they were taking Tylenol PM to help sleep. Well, it's sold over the counter, but that doesn't mean it's safe to take, because the PM piece, that diphenhydramine or Benadryl, actually can worsen your memory. And so it's really important that just because it's over the counter doesn't mean you should take it. Make sure you run it by your PCP. You want to exercise and eat well. The Netflix had the Blue Zone special on it. It was really inspiring. Everything in these blue zones, these areas where many people lived to 100, and they lived to 100 in a great way. They were active, walking up hills, squatting down, what they did. So I think that's I don't get any money back for it, but I think it's a pretty inspiring book and special to read. You want to prevent or control your high blood pressure. That's really important. We don't have people, somebody was mentioning their mother. We just didn't have as good of medications as possible to keep that blood pressure down. And now there's a lot more options. And so it's really important to talk to your PCP. What's my goal blood pressure? What should I be? And make sure that you're taking care of that. If you notice that eating salt can really elevate it, monitor your salt. But I think that's so important to prevent those tiny little small, I'd call them tiny little strokes is the best way. And we call it chronic vessel ischemia. Don't drink a lot of alcohol. I never like to be, to rain on anybody's parade, but I have a good amount of people that come in and they're worried about their memory. And then when I say, you're drinking 2 martinis and then you're having, 2 glasses of wine at night, that's not going to be good for your memory. They don't want to hear that. And, I'm certainly not somebody to force anybody, but it totally has an effect. It crosses the blood-brain barrier. We know as we get older, the recommendations are for women to have 1 glass of wine and for men to have 2. But if you're having memory problems, I recommend less than that. I know it's hard. It can be social. People say this is how I relax. But I think in retirement, people might start drinking more than they did when they were working. And so I think it's important to remember that, if you just drank on the weekends when you were working, you might want to do the same thing. And I'm sorry, that's spelled wrong, but get help if you're feeling depressed or anxious. For a few reasons. Number one, we call depression, severe depression, pseudo dementia, and in many ways, it's has very similar symptoms. You can't remember. Your concentration is terrible. You're not able to take in information in the same way, and so that can really play a role, as well as anxiety. A lot of people, we get asked a lot when we see our PCP about depression, but anxiety, I find, as we get older, has been longstanding. And in the past, it was easily treated with benzodiazepines, Xanax, or Ativan, or clonazepam, which work in the moment, but they do carry long-term effects and can affect your cognition. So if you're on those meds, please do not stop them all of a sudden. They need to be tapered off over, weeks, if not months. So work with your PCP on this. But that's one thing to consider. And if you're anxious and you find that your mind is sort of spiraling out, it can really affect your ability to concentrate. It can affect your sleep. And so it's really important that you focus on this. And then finally, addressing hearing and vision changes if they occur. So when I can't find my glasses, for some reason, I can't hear. I don't even know why that is, but I can't understand as well if I can't see. It's interesting. My husband had a lot of ear infections and can't hear well. And it really affects his ability to obviously hear information and take it in. And, we'll say, we told you this already, but he couldn't hear us. It wasn't that he heard it and couldn't remember. And so I think a lot more people have hearing loss than what's actually diagnosed. If you notice that you're listening to the television a lot louder than it used to be, or people are saying that, take that seriously. Get your vision checked. At least every 2 years, if not yearly, if you need it. Okay. So I want to just stop there and see if anybody has questions or comments. I'm afraid to take my computer off the share, but I wanted to stop there. So if anybody can call my attention, Julie, if you're able to. Any questions or comments?
I mean, I'll pick it off again, and then hopefully others will jump in. We're getting bombarded with, I feel like, pharmaceutical world taking advantage of the issues we're talking about, and selling virtually every day, certainly around the news time, drugs over the counter that are supposedly make your memory better. Is there any research to any of those? Is it hocus pocus, or are there some things that are legit, as from your objective perspective?
Sure. So anytime you see a medication on television, they're trying to sell it, and they are really good, right? They have psychologists on the pharmaceutical teams, and they do a tremendous amount of research, and they get in and they know exactly what our fears are, right? So if something sounds really good on television, it is too good to be true. And so Prevagen, people are spending a lot of money on this, $60, $100 a month, and it's made out of jellyfish, right? And there is no proof that jellyfish helps our memory. And if you look on the label of Prevagen, it actually says, we have actually not had any proof. There's been no study that shows what we're selling is effective in any way. The FDA fined them multiple times, but they're making money, right? So they keep selling it. So the answer is, if there was, it would be out there, right?
Yeah, that makes sense. It's sad that people take advantage of the many of us that are out there who are nervous about, and of course they're promoting that somehow it's going to help you have better memory, but you've answered the question. It's hocus pocus.
Yes. And I think, just as cigarettes used to be advertised on television and that stopped, I honestly feel that we should make our concerns known to, our Congress people. And I don't think it's fair advertising.
Mm-hmm.
All right. I'm going to move forward and
Can I ask one question? I'm sorry, I don't see the hand. This is Scott Nielsen again. I don't see where to raise my hand on this machine. Go
for it.
Seriously, I just forgot what I was going to ask you. But that's
It will
not
come back.
unusual. I'll come back to it. I'll write it down.
All right. And there's going to be other opportunity to answer questions. So we'll keep going.
And by the way, there is a chat at the bottom of your, for those of you that you don't want to forget the question, at the bottom of your screen, there is the word chat. You click on that, you can actually type in your question and we can read those out at the next break for questions.
Alan Hurwitz does have a question. He has raised his hand.
Thank you. Real quick, I just want to make sure I'm understanding what you're saying. In terms of things that are being sold or sometimes recommended even by doctors, that there is nothing out there that you're aware of that helps with memory. Is that what you're saying?
I'm not saying that at all. I'm saying that these things that are advertised on television, these supplements, are not helpful. All right.
Okay, thank you.
And somebody noted about hearing aids, and you're absolutely right. Decent hearing aids are so expensive. And if you want to get me on my soapbox, Medicare, please write letters, do whatever you can. We need to advocate simple things like hearing aids and glasses that completely help our quality of life and our memory should be covered. You can get a pacemaker put in without any question. That can be $70,000, but to get a pair of hearing aids for $5,000, we don't cover it. And that's completely wrong to me. We don't cover dentistry. I honestly don't understand. All right. So when to be concerned? Signs that it might be time to talk to a doctor or your primary care, whoever that is. I don't. If your memory loss is disrupting your daily life, if it's really bothering you or somebody's really pointing it out, I think that could be a sign. That could be a sign. None of these, just if you have these signs or symptoms, it does not mean that you have dementia. I just want to be very clear. It just means maybe this is something that I talked to my PCP about. Make sure you've got the time to have this conversation. This can't happen really in a 15-minute visit. Make a visit just to talk about this, right? Write it down. This is what you're going to talk about. It can't be in the last 2 minutes, right? If you find that you're asking the same questions over and over again, or somebody is answering the same questions over and over again, make sure that if you're talking to this person, that they can hear you, that they've got their glasses on, that their attention is on you. I mean, I think that's important, but that's there. Getting lost in places a person knows well, you've always driven. to the same places and now maybe getting a little bit lost. Having trouble following recipes. We take recipes for granted, but they are actually quite complicated. You have to remember your steps and you have to remember what step you were on, right? Before you can add the chocolate chips in your cookies, you need to add your flour. And so it's really important to know that this is something. If you're becoming more confused about time, people, and places, if you know somebody who's eating poorly, they're eating a lot more sweets than they used to, maybe not bathing as regularly or behaving in an unsafe way. If there's changes in mood or personality, they're acting in a way that they never did. Decreased or poor judgment, thinking about our frontal lobes, withdrawal from work or social activities. I think people consciously and subconsciously may be aware of some memory concerns, and so they actually sort of shut down and close their social activities. If you're having trouble understanding visual images or spatial relations, ships, or if you're having trouble walking and you're noticing that your walking has changed, or maybe you have a tremor. So if that happens, talk to your family and friends to see if they've noticed anything. Often people with early cognitive changes don't recognize it because that section of the brain is affected early on. So that ability to recognize that there's something that's not the same with your brain, that actually is the part of your brain that's affected. So we see that often. So people might be very resistant to hearing that something's going on. That's really common. Talk to your primary care provider and tell them concerns, and then you can think about a referral for further evaluation. Somebody asked about, are there any assessments you can do for yourself? And I think that's an amazing question. I think that not that we know of. So some people will say, well, I practice drawing a clock or what have you, right? But you know, the practicing isn't, I understand what people are trying to do, but the fact that you're practicing, you know, that could affect how you're going to do on an assessment. So at this time, we don't have anything that's really been shown to do a self-assessment. And even I think we're just on the cusp of having lab tests and having imaging to show. But even those assessments, when us professionals do them, can be limited. So I want to talk about the 3 most common types of cognitive impairment. I'm going to keep an eye on the time. And I know there's other questions, but mild cognitive impairment, and dementias, Alzheimer's, and vascular dementia. And so what is mild cognitive impairment? So your normal overall cognition and activities of daily living are preserved. Your functional status is preserved. You're doing your bills. You're able to take your medications. There's no concerns about your driving. But you're just having more trouble with your short-term memory or more changes in other areas. And about 12% progress yearly to Alzheimer's. But this can be reversible. For example, if you have sleep apnea and you get assessed and you start using the CPAP, and you get better sleep, you can actually reverse this, right? Same with when we talked about depression or anxiety, you might qualify here, but if you treat these things, you can reverse this. And so I think that's really important to keep in mind, that this diagnosis is not at all a kiss of death. There's honestly a lot of things you can do. And those are the things that we listed above. So what is dementia? I wanted to just talk about this because I often hear questions about this. Do they have dementia or do they have the Alzheimer's, right? I get this question a lot. Well, and what I say is that dementia is this umbrella term. Alzheimer's is about 60 to 80%. Alzheimer's is a form of dementia. Vascular dementia, we're seeing that more and more, especially as people live longer because of all of our great screening and our great medications, but if they have had a heart attack, we might be seeing more of that. Lewy body dementia is another kind that can look almost like a Parkinson's. Frontotemporal dementia, that's where you might have that change of personality or trouble speaking. And there's certainly others as well, including normal pressure hydrocephalus. And often people have, we often see a mixed dementia. So again, these symptoms, you might have this loss of cognitive function, a change in function, right? What you used to do is now it's just getting harder. People are noticing it more. And it interferes with your quality of life and activities, right? You're not doing as much because you're having more difficulty. You might have trouble with language skills. That's more than the word finding, right? Generally, the words will come to you, but here you might really have trouble. You're sort of reversing words, or you're substituting words. And again, that doesn't mean you have this. I want to be very clear on this. It just means that it's something to be aware of. And, if you're tired or not sleeping well, I think that these things come out way more. If you're going through a really stressful time, or there's been a death in your family, these things really can be affected by this. So just keep that in mind. You have to ask yourself, am I going through a lot more stress than usual? Same with the ability to pay attention, right? If you're tired or stressed, it's really hard to do that. Change in personal hygiene. If you're showing more paranoia, we'll often hear that people are saying people are stealing from them, and they, when they can't find things, we hear, well, I can't, someone's coming into the house and stealing my papers. And mood changes. And so sometimes it's hard to know what brings what, but just to be aware of. And again, you might be having anxiety. That certainly does not mean that you have dementia, just things to be aware of. So what is Alzheimer's? What does it look like? It is these beta amyloid protein deposits. And you can see what a normal brain looks like. The neuron, again, this is what they always called a cartoon in medical school, but I always thought a cartoon should be funny. Then these amyloid plaques come in, as well as these neurofibrillary tangles, these tau tangles. And so up to this time, it's been this progressive disease with no known cure. And it can progress sometimes quickly, sometimes over 20 years, but the typical progression is 10 to 12 years. I think one thing that I think is really important to remember is that the risk of Alzheimer's in our 70s is very, very low. And so I think it's something that we worry about, but it is pretty low. We do know that the risk of it gets higher as we get older. And so sometimes we'll have people in their late 90s who are now having some cognitive impairment. And, that certainly does become more common. So mild dementia, again, these are just everybody's different. You might have a little trouble with dates, right? You might have naming difficulties. You might have trouble managing your finances, or trouble with remembering to take your medications. And you might be a little bit irritable. Moderate comes in, obviously, in that middle stage. Now you're having trouble with date and places. You're having difficulties calculating. There could be more financial trouble. We often find people in this phase, and even earlier, are very financial scams they're everywhere, and all of us are prone to them, but this might be more. You might really stop cooking because it's just, you're not going to tell anybody, and you might not even aware. I'm sorry, I'm going to just finish that.
Is it good?
And so, and you might have some incontinence. That's not related to other things.
That's good.
So, and then severe, your remote memory is not there anymore. You're really having trouble with your words. You're not able to write. Your incontinence has now increased. And they're, really at the end stage. There are these things like weight loss and pressure ulcers and hospice. You might become eligible for hospice at this point. We call it a stage past 7C stage.
I have to go get on my, I'm going to get on my therapy now.
So vascular dementia, and I want to just keep an eye on the time.
I can't take
It's
They say anything about recording?
Need somebody to mute, please? We can hear you.
You could be related to cerebral vascular disease. You might have had, heart disease. Again, what I was talking about, those chronic microvascular changes that we see on MRI, but all of us are going to have some degree of them. People who have had a large stroke, about 25%, meet criteria for dementia later on. Although depression is also very common, so just keeping that in mind. Just so you can see what a normal brain MRI looks like and a normal PET scan versus Alzheimer's, and then versus frontotemporal dementia. Again, that's the front of the brain right there. But when we're doing evaluations, we may order brain imaging. We look at some lab tests, and we might send for a neuropsych assessment. Now, if there are things on the horizon which insurance is starting to cover, but still maybe not, one could be a PET scan, and those could be $5,000 or $6,000. It depends. Not everybody's doing them. You need somebody to read them. Again, it doesn't mean it's not a diagnosis in and of itself. You have to take the whole picture. There's also some blood tests that are now showing that might show levels of amyloid. But again, that doesn't mean that you might have a high level of amyloid and not have the symptoms. And so I think that's a really important thing to note. And even genetic testing, looking at levels of ApoE. It's important at this stage to note that a definitive diagnosis can only be done with a brain biopsy. And that's just this time not possible when somebody's alive. This is all changing. So the diagnosis is a working diagnosis. This is the best thing that we think is going on. And so if you know somebody that's had this diagnosis or you've had it, I think it's really important to create a plan, thinking about treatment options. I think all of us should have a care plan. What happens if we do develop cognitive impairment? We should all have financial and legal planning done. I think that's crucial. We should all make known our wishes for care. April was Healthcare Proxy Month. There's honoring choices or 5 wishes. We should all do this. And we should, make sure that, these things are done in time, in good time. Don't wait until there's a crisis. So I'm going to go on to treatments. I just want to make sure it's 5 o'clock, see if anybody has questions or comments.
There's a question in the chat. I guess somebody it's pretty specific, looking for a list of specialists and or practices that do deal with this. I know you do, and your practice specializes. And I guess, depending on what people have for insurance and the like, they may be tied into other systems. So I don't know if that's where the question came from, but where would people learn of the best resources if they did need to talk to a specialist?
Okay. And I think it's a great question. We've shown that cognitive-based therapy for insomnia, so CBTI, has been shown to be very effective for sleep. If you look on, we had a list, but after COVID, everybody's changed. Wendy Shabbat was amazing, but she has since retired. If you look on Psychology Today, you might be able to find somebody who can do that, who can help you with that. Nowadays, people can do Zoom, so you can look a little farther afield. You could look in UMass Worcester. We found some great resources there, and maybe even the Berkshires. And then obviously there's Boston as well.
Sorry, that was the question I forgot earlier about the providers, but in particular, the relationship between sleep and dementia and understanding, that. So, and somebody did suggest Wendy Shabbat, and it's unfortunate to hear that she's retired. So even out in Boston, we're looking around. So
It's there even is some apps on the phone that you can get. One is with Johns Hopkins and the VA, and I
Okay.
think it's a free app you can get on your phone. I'm just looking for it right at the moment, called CBTI Coach, and that can help you. Apps on your phone like Insight Timer can have some things for sleep, some either relaxing music or even some help to help you fall asleep. So those are things you could try too in the meantime. So I want to hit on dementia treatment and what works and what doesn't work, what may work. And I want to talk briefly about the new medication that's on the horizon. So again, we talk about the diet, physical exercise, what's good for the heart is good for the brain, the mental exercise, watching television. And they did a study in Australia that watching television was actually more harmful for your health than smoking cigarettes. Like they compared one cigarette to minutes of TV. We're not talking about a couple hours of watching television. We're talking about all day. Meditation or Tai Chi can certainly help. What doesn't work, and this goes to the Prevagen. And so the Federal Trade Commission charged the makers of Prevagen with false and deceptive advertising. The company study itself found that it was no more effective than placebo. But it sells, and there's always something else coming out. What may help is these anticholinesterase inhibitors. They prevent the breakdown of acetylcholine, which is this chemical messenger that sort of bathes the neurons, and it's important for learning and memory. And it may delay or slow the worsening of symptoms by about 6 months. It's not been shown to improve memory. The effectiveness varies, and it's really important. And this is pro-cholinergic, and so we want to make sure that somebody's not on any anti-cholinergic medications, such as oxybutynin and donepezil. And so just asking your PCP, is this medication anticholinergic? And if there is anything else that might work, there might not be. And so you weigh out your benefit and risks. Memantine is our sort of a second medication that we use for moderate to severe dementia. It works a little bit differently on glutamate, and they're not actually sure why it works, but it is the second medication. Again, it generally doesn't improve memory, but may slow down memory. So there are now these new medications on the horizon. The current one that's been approved is Leqembi, and the FDA granted accelerated approval after the results of a phase 3 clinical trial. There was another medication similar to this where the FDA board members all resigned because they didn't feel that it should have been approved, but this one now is approved, and it's shown to moderately slow cognitive and functional decline. It's the first medication for MCI, or mild cognitive impairment, or early stage cases of Alzheimer's dementia. It costs $26,000 per year. Medicare did cover, actually, so I'm sorry that they did decide to cover it. It works to remove these amyloid plaques from the brain. That was one of the slides I showed you. And it slowed decline 27% after 18 months compared to those who received placebo. It's at this time very complicated to give. We are not giving it at Cooley. Dickinson. Bay State has just started, but they can only manage 200 patients a year, just to give you some sense. Even in at Mass General Hospital and Brigham, we meet regularly, and they have given it but to a handful. You have to join a registry. You need to check these biomarkers, generally with a lumbar puncture that's, taking out spinal fluid. You need these PET scans and MRIs, and you monitor for side effects. And you have to get this infusion every 2 weeks for 18 months.
Oh.
So it is not something that's simple. Side effects, the initial infusion related. So the first time you get the infusion, you're there for 4 hours. The second infusion, you're there for 3 hours. And then after that, you're able to increase the frequency. There are these side effects that, again, are being studied, some swelling as well as some brain bleeds. And again, I don't think it's been studied enough to know. They do note that people who are ApoE positive, that's this biomarker, are more prone to have these. And so, they're trying to monitor this very carefully. So this is where we are now. There's a few other meds that are up and coming, and one is coming out that's going to be subcutaneous, that you can just give it under your skin. I think that will be obviously a game changer. So these exist. They're very hard to get. They're very hard to give, but who knows? They're kind of right on the horizon. And so we don't know what the future holds. So I'm going to just keep going, and I'm going to hold questions until the end. I just want to point out that no matter what age you're at, no matter where you are in life, I think care planning is so important. I spoke to somebody in their 90s. They didn't have a will. I was in shock. So really important, get a will, spend the money, get your power of attorney, get your healthcare proxy. Plan for your current needs and anticipated care needs. I hear of people retiring to the hill towns, and it's beautiful, and I'm not against them. They're gorgeous, but it's a lot harder to have resources up there. We've just heard. So plan for when you can't drive. Please, everybody, we're all at some point going to have to retire from driving, right? It's so ingrained in us as Americans. This is also where we have to push for more public transportation. I'm dying to have a train go from Northampton to Boston. But plan for when you can't drive. Know that it's likely going to happen. People become so upset when I tell them they shouldn't be driving, and so in shock, and families as well. How are they going to manage? And so I think it's just really important to start thinking about it. That's where Amherst Neighbors can come into play. There's people that can volunteer for rides. Think about home safety, where you're living. If your bedroom is up on up a flight of stairs that's really narrow, think about how to make it safer. Think about how getting a bathroom down on the main floor. Do your advanced care planning, your healthcare proxy. I always say everybody over the age of 18 should have a healthcare proxy. That's my soapbox. Assess capacity. What is somebody's ability to understand what's going on with them? If you have concerns, you can certainly talk to them, their family, their PCPs. Maintain those social connections. Another plug for Amherst Neighbors. The Dementia Roadmap, I think, is a great resource. You can find it online. And caregiver support is crucial. If you know somebody who's struggling with a loved one who has cognitive impairment, really do what you can to support them. I think sometimes when we've seen that when people develop cognitive impairment, people stay away. I don't know if they're scared it's contagious, or they don't know what to do or say, but really everybody, not everybody, but so many people could benefit from even a meal or just asking them how they're doing. It's a really stressful time. And we know that a person, a care partner really can suffer. It was one reason why, we felt so strongly about Pioneer Valley Memory Care Initiative, that it was needed. Just a quick note about driving. Drivers with dementia are 2.5 to 4.7 times more likely than those who don't have dementia to be involved in motor vehicle accidents. And the consensus is that those with moderate to severe dementia should not drive. We don't get tested right now. I think our state's people are too, worried about voting, but it's really, just something to be aware of. Caregiver issues, again, to my point, we know that over 50% of caregivers can develop depression, anxiety, burnout, and it can be really hard. So there's a lot of, we have areas around here that can support people. I think there's so much more that we have to do. Again, working with our state and federal level to get more supports. We can say you need respite care, but to pay for it can be really expensive. And so we really need to advocate for this. So in summary, every person is unique. We all have different strengths and different stories. Because your mother had dementia does not mean you're going to get dementia, right? Because it runs in your family does not mean that you're going to get it. We don't really know. There's so much involved into it. We know that people who have had PTSD might be more prone. We know that people who have higher resilience are less prone. But be informed and prepared. And I always say, for everything, hope for the best, plan for the worst. This is why we have life insurance. We don't ever want to use it, but be prepared. It takes a village. Don't hesitate to lean out for support, build your team, but also, offer to be part of the team. And if somebody offers and you need it, take it up. I think that's really important. So there is, I think, tremendous hope for treatment on the horizon as we get more genetic testing and, really individualizing drugs. I think there's going to be a lot more hope for that. So on that note, I want to stop. I'm happy to take questions. I just want to make a plug for one of our other geriatrician at Cooley Dickinson, Dr. Johnny. He's giving a talk on polypharmacy at the Forbes Library in Northampton, May 18th at noon. And again, we know that medications can affect cognition, so always important to be aware of. And on that note, I just want to, again, thank you, everybody, and see if anybody has further questions or comments. And feedback. I want to make sure that this is helpful, and then I've been able to answer everybody's questions.
Can you unshare the screen?
I will stop the share, absolutely.
And Michael Childs has a question.
Thank you. This is very, very nice, this whole presentation. I'm wondering if it's possible for you to download the slides to us in some way.
Sure.
They'd be very, very nice to have.
Sure.
And also, if there are any other books that you recommend other than the Dementia Roadmap.
If you look on the CDMG Geriatrics website, there's a lot of great resources on there. There's a link to the CDMG Geriatric Caregiver Support Programs. So a lot of great resources and some books listed, as well as some videos.
And Alan, you have a question as well? Unmute yourself.
Yes. Thank you very much. Yeah, just another question about treatments. I get the part about things advertised on television. I apologize. I was out for a couple of minutes. I was trashing a few bottles of Prevagen that I had lying around. So thank you for that. But I've been over the last year or two. I've been various things have been recommended to me. I don't want to be really specific about the doctors or the recommendations, but people have recommended, mostly what do you call them? Not prescriptions, but supplements. Yeah. And do you have any suggestions about how we can evaluate these suggestions I'm talking about from doctors that have suggested one thing or another for helping us with these issues? I feel like I'm at a loss to even evaluate something. I know not commercial ones, I get it, but what about doctor recommended substances of one kind or another?
Sure. And I'm not exactly sure what, you're talking about, so I can't speak to that, but I think it's okay to ask. If you get the recommendation, can you point me to some evidence-based we try to always practice evidence-based medicine for this. Can you point me to some evidence that shows that this is effective and why? And I think that's a very fair question.
Mhm. Do you want me to mention one? I could mention one if you want or not.
If you want, I want to make sure we get to everybody's question, but do you want to mention?
Well, someone recently recommended something called Cerebro Pep. And there's, I don't want to take the time to read and
Yeah.
read something, but
There is so much hope out there that something's going to help. It's hard because supplements are not FDA studied, so we don't always have a lot of evidence about them. There's one doctor that writes and sells all these supplements, so then there's money involved there. So I do a lot of reading. I haven't found anything yet that is, we want it to hold things off in reverse, and I'm not aware of anything that does that.
Thank you.
Martha, you had a question?
Yes. Well, I didn't have a question. I just wanted to thank you. And I am one of your annual patients that will be missing you. And I'll see Dr. Johnny, I guess, in June. But what I'm getting is that the difference between normal aging and what's the next, oh, now I've forgotten the word, the beginning of the other, it's very loose. And so it's not so clear, but what I think the point that I got was watch things carefully, pay attention, have your friends pay attention, and make a plan.
Mm-hmm. I think those are the best things. And don't live in fear. I think that's so important, to not live in fear. Live your life to the fullest and try not to let fear take over things. But if you have your plan, you can live your life to the fullest, and I think that's the best you can do. Yes.
Ramon had a question?
Yeah.
Ramon, if you want to unmute yourself.
Can you hear me?
Yes.
Okay. My question is, I am not so much for what you call traditional medicine. I'm more interested in the research that's being done using natural products from plants, from flowers, from blueberries is like almost number one. That really helps with the memory, and also mushrooms and things like that might not cure you from the state that you are in right now, but you might not get worse. And so I'm following a few people on the internet they do mainly research on natural ways of taking care of your body through Mother Nature.
All right. I mean, there's certainly a lot out there, and, blueberries have great antioxidants, which I think absolutely can help. That's, I was pointing to the blue zone. There's certain things that we know that can help our overall health, and that plays a role.
Yeah.
Elsie,
So, but where would you go? Do you know anybody around here?
I don't.
Focuses on something like that?
I don't. I'm sorry. I'm more of a Western medicine person, so sorry. Yes, Elsie.
Well, I just heard someone say they're going to miss Dr. Rebecca Starr, and I just wanted everyone to know that Dr. Starr has her own office on Elm Street, and she'll see Dr. Starr because they had told me the same thing. And I said, I want Dr. Rebecca Starr. So if you or anyone who is watching this today, I want you to know that I went to see her and I was her first patient. And a couple of years ago, when my daughter said she had wanted me to see a gerontologist, Rebecca spent 2 hours with me, 2 hours. I'll be 97 years old. She had 2 recommendations. I go to Pilates and I take B12. And I follow her recommendations. And God willing, another month I'll be 97. So I thank you very much, Dr. Starr. And you don't have, just because Cooley Dick tells you she's not there anymore, she's there on Elm Street in Northampton.
Well, thank you, Elsie. I didn't pay her, I promise. So
It's a great plug, Elsie. Great plug. And we also, while we're plugging, we're going to plug the Pioneer Valley Memory Care Initiative again, because Dr. Starr was referencing caregiver stress and also all of our goal to stay in our own home as long as possible. And there's a lot of folks in the Valley that fall into this category. Amherst Neighbors has buddied up with the Pioneer Valley Memory Care Initiative. And honestly, any of us can step up. Fabulous training that's provided through the Pioneer Valley Memory Care Initiative to have you ready to do these friendly visits with folks. It gives the person that's dealing with that intense stress and burnout an opportunity to get a breather, go shopping, go take a walk in the woods or whatever, while you're with their loved one who's challenged with the cognitive decline and dementia-related issues. It's a great program. I've personally been doing it for about 1.5 years. And I get something from it. So those of you looking for an opportunity to volunteer, you need to let us know. We can get you connected to it. It makes you feel good. So it's an important plug because a lot of folks are living with these challenges in our area. So that's all I wanted to say about that. Any other final questions? Or yeah,
Eileen has her hand raised.
Yes, hi. You mentioned there was a testing list, and B12 was in there, and there was just a reference to B12. And could you speak about that, the efficacy and perhaps the amount?
Sure. Again, B12 doesn't get absorbed as well as we get older, but some people are just fine with it. So I don't recommend taking amounts of it until you get tested. But it has B12 does a lot with our brain cell function. B12 has a lot of uses, right? It's how our cells develop, and it's important for our brain development. It's actually important for walking. And so, we want to make sure that everything is optimized as well as we can. And so that's one of the things we check: B12 and folate, and just making sure we're doing everything we can to give our brain cells the boost that they need.
Thank you.
And Larry, thank you for all that you do. I was, so touched with you saying that about being a volunteer, and I'm glad that you've found it rewarding. We know that.
It's a win-win. It's a good program. And is there any final questions before we wind it down? I see Jane with a hand up.
Yeah, am I muted? Okay.
No, we can hear you, Jane.
Okay, so I've noticed that a lot of my friends recently have been bringing up the topic of forgetting things and all of the things that we talked about at the beginning, going to a room and not knowing why you're there. And I'm thinking specifically about our volunteers, but also for people in general. When somebody raises those kinds of issues with you, what's a good way to respond to that? How should we respond?
It's a great question. I think you could ask them, is this something you're worried about? Right? Are they looking for, I'm feeling the same way. I'm struggling with that. They might want a little, just how we all want is a little reassurance, right? It might be a little bit more than that. And if you're not sure what to say, you could always say, that's, talk it over with your primary care. Bring it up to whoever it is you're seeing and see. Anybody else have a good suggestion for what to say if somebody says that?
I think you got to go a little bit deeper with, the initial question to find out how, as you talked about there, as somebody else mentioned, it's kind of subtle. You go from thinking this is normal, I forget, to how much is it affecting your daily life? So you got to fish a little bit to find out how significant is this? Is it once in a while, or is it every day? Is it, how is it really impacting your ability to, do your morning routine, to eat your meals, kind of the basics of living, and get a sense, because at some point, because you referenced, there's not a lot of self-awareness, that's part of this process. It gets a little bit tricky as to when to recommend somebody should go see their doc, or go talk to a specialist, or get some testing with a psychologist that does neuropsych testing to give you more ammunition or real true information. So it's a conversation, like you said, it's questions, open-ended questions to get how big of an issue is this? And some people do need the reassurance from a specialist.
Mm-hmm. Yep. And again, sometimes it's just taking a look at all those things. How are you sleeping? How's your mood, right? What meds are you on? It's, it's doing those reviews, which are good. Those are, good things to look at.
We are going to wind this puppy down. It's been a wonderful hour and a half. We are super happy that Dr. Starr gave us this much time. And, it's something that's on a lot of our minds, and we deal with it with our family members, loved ones, in addition to wondering about our own paths. So we are so appreciative. There's literally about a 30-second when you sign off a few questions. It would take you no more than a half a minute to give us feedback so we can share feedback with Dr. Starr and Amherst neighbors as to how this went. So thank you, everybody. We'll be back on again on May 9th with an aging in place discussion. And if some of you are interested in that topic, please feel free to join us. Thank you, Dr. Starr.
Thank you so much for having me. Thank you.
Yay.